Assalamu alaikum everyone. I hope you are all doing well. Now let's start today's PMC Certified Workshop on Soft Tissue Mobilization Techniques. First of all, I would like to warmly welcome each and every one of you. Thank you for joining this workshop and investing your time in improving your clinical skills. My name is Dr. Mariam Tahir, CEO and founder of PMC Professional Hub, HCPC UK registered, and I will be your instructor for today's session. Okay, before we move ahead, you should know that soft tissue mobilization or STM is one of the most commonly used manual therapy techniques in physiotherapy. Whether you work in musculoskeletal rehabilitation, sports physiotherapy, neurological rehabilitation, or general clinical practice, these techniques can help improve patient outcomes when applied correctly. During this 90 minutes of workshop, we will not only discuss the theory but also focus on the clinical application of these techniques. We will cover the principles of STM, indications of STM, contraindications, assessment, different mobilization techniques, and how to apply them safely and effectively in real patients. I encourage everyone to stay focused throughout the session. If you have any questions, feel free to note down them and we will discuss them during the question answer session at the end. So let's begin our learning journey and explore soft tissue mobilization techniques in a practical and evidence-based way. Okay, now let's move to our learning objectives. Before we start learning any practical skill, it's always important to know what we are going to achieve by the end of the session. This helps us stay focused and understand the purpose of today's workshop. By the end of this workshop, you should be able to firstly define soft tissue mobilization STM and understand its role in modern physiotherapy practice. Secondly, identify the anatomy of the soft tissues, including muscles, fascia, tendons, and ligaments, because a good understanding of anatomy is essential before applying any manual therapy technique. Okay. Thirdly, recognize the indications and contraindications of STM. This is very important because patient safety always comes first. Knowing when to perform a technique and when to avoid it is a key responsibility of every healthcare professional. Next, you will learn the most commonly used soft tissue mobilization techniques and understand when each technique is appropriate for different clinical conditions. We will also discuss how to assess a patient before treatment, including palpation, tissue quality, pain assessment, and functional movement. Remember, a proper assessment should always guide your treatment plan. Finally, you will learn how to apply these techniques in clinical practice using an evidence-based approach to improve pain, mobility, and overall patient function. Now, one thing I want you to remember throughout this workshop is that manual therapy is not just about using your hands. It's about clinical reasoning, understanding the patient's condition, selecting the right technique, applying it safely, and then reassessing the outcome. So, keep these learning objectives in your mind as we move forward. Let's now begin by understanding what soft tissue mobilization actually is. Okay, now let's start with the most important question. What is soft tissue mobilization or STM? Before we learn the techniques, you should know exactly what STM means and why it is such an important part of physiotherapy. Soft tissue mobilization is a hands-on manual therapy technique used by physiotherapists to assess and treat problems involving the body's tissue, that is, involving the body's soft tissues. These soft tissues include muscles, fascia, tendons, ligaments, and connective tissues. The main purpose of STM is to restore normal tissue mobility and function. When soft tissues become tight, injured, or develop adhesions, they can restrict movement and cause pain. By using specific manual techniques, we can help improve tissue flexibility, reduce pain, and promote healing. Now you should know what is STM and why is not simply a massage. Okay. Now you should know that STM is not simply a massage. This is the common misconception. Massage is generally used for relaxation and improving circulation, whereas soft tissue mobilization is a clinical evidence-based treatment. Every technique is selected based on the patient's assessment, diagnosis, and treatment goals. So, before applying any technique, we must first identify which tissue is affected, why it is affected, and what outcome we want to achieve. That is what makes STM a skilled manual therapy intervention rather than just rubbing the muscles. Let's look at the main goals of tissue mobilization. First is to reduce pain and muscle tension. Second is to improve blood circulation and tissue nutrition. Third is to increase flexibility and range of motion. Fourth is to break down adhesions and scar tissues. Next is to restore normal movement patterns and to enhance healing and functional recovery. And at last is to prepare tissues for exercise and rehabilitation. In clinical practice, STM is commonly used for patients with neck pain, low back pain, shoulder dysfunction, sports injuries, muscle strains, tendinopathies, post-operative stiffness, and myofascial pain syndrome. It is a versatile technique that can be applied across many areas of physiotherapy. One important point you remember is that soft tissue mobilization works best when it is combined with other evidence based interventions such as therapeutic exercise, stretching, patient education, and posture correction. Manual therapy alone is rarely enough to achieve long term results. Okay, now that we understand what soft tissue mobilization is and why we use it, let's move to the next slide and review the soft tissue anatomy that every physiotherapist should know before performing these techniques. Okay, now let's move on to soft tissue anatomy. Before performing any manual therapy technique, you should know the anatomy of the structures you are treating. If you don't understand the anatomy, it becomes difficult to identify the source of pain and choose the correct treatment technique. Soft tissues are the body's supporting structures. Basically, they provide stability, movements, flexibility, and protection. As physiotherapists, these are the tissues we assess and treat on a daily basis. Let's discuss the main soft tissues one by one. First is the skin. The skin is the outermost layer of the body. It protects the underlying structures, contains sensory receptors, and allows us to assess tissue temperature, swelling, scars, and tenderness during examination. Next is the superficial fascia. This layer lies just beneath the skin. It contains fat, blood vessels, lymphatic vessels, and nerves. It allows the skin to glide smoothly over the deeper tissues. Then we have the deep fascia. Deep fascia is a dense connective tissue that surrounds muscles, bones, nerves, and blood vessels. It provides support, transmits force, and allows different muscles to move efficiently. When fascia becomes tight or restricted, it can reduce mobility and reduce pain. Okay. Now let's talk about muscles. Muscles are responsible for producing movement, maintaining posture, and generating force. Overuse Poor posture, trauma, or repetitive activities can lead to muscle tightness, trigger points, and reduce flexibility, making muscles one of the most common targets for soft tissue mobilization. Next are tendons. Tendons connect muscles to bones. They transmit the force produced by muscles to create movement. Tendons can become irritated due to overuse, leading to conditions such as tendinitis or tendinopathy. Next is ligaments. Ligaments connect bone to bone and provide stability to joints. Although STM is mainly directed toward muscles and fascia, surrounding ligaments tissues may also benefit indirectly by improving mobility and reducing muscle tension around the joint. Now the next is scar tissue and adhesions. After surgery or injury, scar tissue may develop. Sometimes this scar tissue becomes excessively rigid and restricts normal movement. Soft tissue mobilization can help improve tissue mobility and reduce adhesions when applied appropriately. Now you should know that all of these tissues work together as one functional system. If one tissue becomes restricted, it can affect movement, posture, and even place extra stress on nearby joints and muscles. That's why before beginning treatment, we always palpate the tissues carefully, identify the involved structures, and then select the most appropriate manual therapy technique. Remember, one important clinical principle, that is, treat the tissue, not just the pain. Understanding anatomy allows you to treat the actual source of dysfunction rather than only addressing the symptoms. Okay? Now that we have reviewed the soft tissue anatomy, let's move to the next slide and discuss the clinical indications of soft tissue mobilization. When and why we use these techniques in physiotherapy practice. Okay, now let's move on to the indications of soft tissue mobilization. Now that we know what STM is and understand the anatomy, the next important question is, when should we use soft tissue mobilization? As physiotherapists, you should know that every treatment must have a clinical indication. We don't perform manual therapy simply because it feels good. We apply it only when it is appropriate for the patient's condition and supported by our assessment findings. Let's discuss the common indications one by one. First is muscle tightness. One of the most common reasons for using STM is muscle tightness. Tight muscles can limit joint movement, alter posture, and cause pain. Soft tissue mobilization helps relax the muscles, improve flexibility, and restore normal movement. Next is myofascial pain. Patients with myofascial pain often complain of deep itching, discomfort, and stiffness. STM helps release facial restrictions and reduce pain by improving tissue mobility. Okay. Next is trigger points. Trigger points are hyper-irritatable spots. Okay. Trigger points are hyper-irritatable spots within a muscle that can produce local or referred pain. Through techniques such as sustained pressure and trigger point release, STM can help decrease muscle tension and relieve symptoms. Next is sport injuries. Athletes frequently experience muscle strains, overuse injuries, and post-exercise muscle tightness. STM can improve circulation, reduce muscle soreness, and support recovery as part of a comprehensive rehabilitation program. Next is muscle spasm. Following injury or prolonged poor posture, muscles may go into protective spasm. Soft tissue mobilization can help reduce excessive muscle tone, allowing the patient to move more comfortably. Next is reduced flexibility. Limited flexibility affects posture, gait, and functional activities. STM helps improve tissue extensibility and can be combined with stretching exercises to achieve better results. Seventh is scar tissue and adherence. After surgery or injury, scar tissue may become thick and restrict movement. Appropriate soft tissue mobilization techniques can help improve tissue mobility and reduce adherence during the healing process. Eighth point is postural dysfunction that we have discussed now. We have discussed scar tissue and adherence. Let's discuss postural dysfunction. Poor posture often places excessive stress on muscles and fascia, leading to pain and tightness. STM helps reduce muscle tension and prepares the body for posture correction and exercises. Ninth is chronic neck and low back pain. Many patients with chronic musculoskeletal pain benefit from STM because it reduces muscle guarding, improves mobility, and enhances function when combined with exercise therapy. And 10th and the last is tendinopathies. Conditions such as tennis elbow, Achilles tendinopathy, or patellar tendinopathy may benefit from specific soft tissue techniques when used alongside an evidence-based rehabilitation program. Now, one of the important points you should always remember is that soft tissue mobilization is not a standalone treatment. It works best when combined with patient education, stretching, strengthening exercises, posture correction, and functional rehabilitation. As clinicians, our goal is not only to reduce pain but also to restore movement and improve the patient's quality of life. We have discussed when STM is indicated, but equally important is knowing when we should not perform these techniques. So let's move to the next slide and discuss the contraindications and precautions of soft tissue mobilization. Now let's move on to one of the most important topics of today's workshop, that is contraindications and precautions. Before applying any manual therapy technique, you should always ask yourself one question: is it safe to treat this patient? Patient safety must always come first before treatment. No matter how effective a technique is, if it is applied to the wrong patient or at the wrong time, it can do more harm than good. Let's first discuss the absolute contraindications. These are situations where soft tissue mobilization should not be performed at all. First is open wounds. If the patient has an open wound, cut, or unhealed surgical incision, avoid treating directly over that area because it may delay healing and increase the risk of infection. Second is active infection. Never perform STM over an area with a bacterial, viral, or fungal infection. Manual therapy may worsen the infection or spread it to surrounding tissues. Third is deep vein thrombosis, that is DVT. This is a medical emergency. If a patient has a suspected or confirmed DVT, do not apply massage or soft tissue techniques. Manipulating the area could dislodge the clot, leading to a pulmonary embolism, which can be life-threatening. Fourth is acute fractures. If a bone is fractured and has not healed, manual therapy around the injured area is contraindicated because it may interfere with healing and increase pain. Fifth is malignancy. Avoid applying STM directly over a known cancerous area unless specifically advised by the patient's oncology team. Patient safety and medical guidance should always come first. Now let's discuss some precautions. These do not always mean that STM is prohibited, but they require extra care, clinical reasoning, and sometimes medical clearance. Okay, so let's discuss the precautions. First is osteoporosis. Patients with osteoporosis have fragile bones. Apply only gentle pressure and avoid aggressive techniques that may increase the risk of injury. Second is diabetes. People with diabetes may have reduced sensation, delayed healing, or circulation problems. Always monitor tissue response and adjust your treatment accordingly. Next is patients taking anticoagulants. Patients on blood thinning medications bruise more easily. Use light pressure and avoid deep or forceful techniques. Okay. Next is pregnancy. Certain areas and positions should be avoided during pregnancy, especially without appropriate training. Always ensure patient comfort and follow safe clinical guidelines. Next is sensitive or fragile skin. Older adults or patients with delicate skin may require very gentle treatment to prevent skin damage or bruising. Next is acute inflammation. If the tissue is hot, swollen, and highly painful, aggressive STM may worsen the inflammatory response. In these cases, focus first on reducing inflammation before introducing manual therapy. Okay. Now, here is an important clinical tip that every physiotherapist should remember. Never rely only on the patient diagnosis. Always take a detailed history, ask about medications, examine the affected area, and perform a thorough assessment before starting treatment. If you are ever unsure whether STM is appropriate, it is always better to delay treatment and investigate further rather than risk harming the patient. Remember this simple principle: assessment first, treatment second. Safety always comes first, okay? Now that we know when soft tissue mobilization should and should not be used. Okay, let's move to the next slide and learn how to perform a proper patient assessment before beginning the treatment. Okay, now let's move to one of the most important parts of today's workshop, that is patient assessment. Before applying any soft tissue mobilization technique, you should know that assessment always comes first. A successful treatment doesn't begin with your hands, it begins with your clinical reasoning. Many new therapists make the mistake of starting treatment immediately. However, as physiotherapists, our first responsibility is to understand the patient's problem before deciding how to treat it. So let's discuss what should be included in a proper assessment. First is patient history. First of all, take a detailed history. Ask the patient, where is the pain? When did it start? How did the injury occur? Is the pain constant or only during movement? Have they had this problem before? Are they taking any medications? Do they have any medical conditions like diabetes, osteoporosis, or bleeding disorders? A good history often provides valuable clues about the cause of the problem. Second is pain assessment. Next, assess the pain of the patient. Okay, ask them to rate their pain using the numeric pain rating scale from 0 to 10, where 0 means no pain and 10 means the worst pain imaginable. Okay, also determine the location of pain. whether it is sharp, dull, burning, or itching. Does it radiate anywhere? What activities increase or reduce the pain? Understanding pain helps guide your treatment plan. Okay, now simply observe the patient. Third step is observation. You should look for swelling, redness, bruising, muscle wasting, postural changes, protective guarding, asymmetry between both sides. Okay, sometimes observation alone can tell you a lot before you even touch the patient. Okay, fourth is palpation. Okay, which is one of the most important clinical skills. Using your hands, assess muscle tone, tissue temperature, tenderness, muscle tightness, trigger points, facial restrictions, scar tissue or adherence. Remember, palpation should always be gentle and systematic. Don't press too hard at the beginning, especially if the patient is already in pain. Next, assess both active and passive range of motion. The fifth step is range of motion, ROM. Look for pain during movement, joint stiffness, muscle tightness, and movement limitations. Okay, comparing the affected side with the unaffected side is often very helpful. Okay, finally, observe how the patient performs daily activities. Okay, this is the sixth step, that is functional assessment. Okay, ask questions such as, can they walk comfortably? Can they lift their arms overhead? Can they squat, bend, or climb stairs? Is the pain affecting their work or daily routine? Our goal is not only to reduce pain but also to improve function and quality of life. Now, one important thing I always tell my students is that don't treat what you think is wrong. Treat what your assessment proves is wrong, okay? Good assessment leads to accurate diagnosis, appropriate treatment selection, and better patient outcomes. Always remember the sequence: history, observation, palpation, range of motion, functional assessment, and then treatment at last. If you follow this order every time, your clinical decision making will become much stronger. Okay, now that we have completed the patient assessment, let's move to the next slide and discuss the fundamental principles of soft tissue mobilization that every physiotherapist should follow during treatment. Okay, now let's move to the principles of soft tissue mobilization. Now that we have assessed our patient, the next step is learning how to perform STM correctly. Remember, knowing a technique is not enough. You should always know the principles behind it. Following these principles makes your treatment safe, effective, and comfortable for the patient. First of all, position your patient correctly. First principle is proper patient positioning. The patient should be comfortable, relaxed, and the treatment area should be fully supported. For example, if you are treating the upper trapezius, make sure the patient is sitting or lying in a comfortable position with the shoulders relaxed. A relaxed muscle is always easier to assess and treat than a tense one. Okay. Now let's talk about the therapist. Second principle is correct therapist posture. Many physiotherapists focus only on the patient and forget about their own posture. You should protect your own body mechanics. Stand with a stable base of support. Keep your back straight. Bend from your hips and knees instead of your spine. And use your body weight instead of your hands. This reduces fatigue and prevents work-related injuries. Before starting treatment, always make sure your patient is relaxed. Okay, it's a third principle, that is patient relaxation. Explain the procedure, answer any questions, and gain informed consent Encourage them to breathe normally and avoid guarding their muscles. A relaxed patient responds much better to manual therapy. Okay. Fourth principle is appropriate pressure. Now, one of the most common mistakes is using too much pressure. More pressure does not mean better treatment. Always start with gentle pressure and gradually increase it according to the patient's tolerance. Your pressure should be enough to affect the target tissue without causing unnecessary pain. Remember, treatment should feel therapeutic, not unbearable. Okay. Fifth principle is controlled movement. Every movement during STM should be slow, controlled, and purposeful. Avoid quick or jerky movements because they can increase muscle guarding and reduce treatment effectiveness. Move in the direction that best suits the treatment goal and always maintain good hand contact with the tissue. Sixth principle is good communication. Communication is just as important as your technique. Throughout the treatment, keep asking the patient, how does this feel? Is the pressure comfortable? Do you feel pain or just pressure? Patient feedback helps you adjust your treatment safely and builds trust. Okay. Seventh is continuous reassessment. Assessment doesn't stop after you begin treatment. After each technique, reassess the patient. Check. What do you check? You should check, has the pain reduced? Has the range of motion improved? Does the tissue feel less restricted? Can the patient move more comfortably? This tells you whether your treatment is working or not. Okay. Eighth principle is hygiene and professionalism. Finally, always maintain high professional standards. Wash or sanitize your hands before and after treatment. Keep your treatment area clean. Ensure patient privacy and always maintain professional communication and ethical practice. These small details create confidence and improve the patient's overall experience. Okay. Now, here is an important clinical message that I want all of you to remember, dear all students. Soft tissue mobilization is not about strength, it is about skill. Okay. A therapist with excellent assessment, proper body mechanics, and good clinical reasoning will always achieve better results than someone who simply applies excessive force. So, always follow these principles. Assess first, position correctly, secondly. Thirdly, use proper body mechanics. Fourth, apply appropriate pressure. Fifth, communicate with your patient. Sixth, reassess after treatment. If you make these principles a habit, your manual therapy skills will become much more effective and professional. Okay. Now that we have learned the basic principles of STM, let's move to the next slide where we will start learning the first soft tissue mobilization techniques used in clinical practice. Okay, now let's start learning our first soft tissue mobilization techniques. These are the foundation techniques that every physiotherapist should master before moving on to more advanced manual therapy methods. The two techniques we will discuss are Effleurage and Petrissage. Let's begin with Effleurage. Effleurage is a French word that means to skim or to glide. It involves using long, smooth gliding strokes over the skin and muscles. Usually we perform Effleurage at the beginning and at the end of a treatment session. Okay. Now, why do we use Effleurage? Its main purposes are to warm up the soft tissues, to increase local blood circulation, to improve lymphatic and venous return, to help the patient relax, and to prepare the tissues for deeper manual techniques. While performing Effleurage, keep your hands relaxed and maintain full contact with the patient's skin. Apply light to moderate pressure and move slowly in the direction of the muscle fibers or toward the heart when appropriate. One important tip: don't rush, slow, controlled movements are much more effective than fast strokes. Okay, now let's move to Petrissage. Petrissage means kneading, lifting, squeezing and rolling the muscles. Okay. Unlike Effleurage, Petrissage works on the deeper muscle tissues. During this technique, gently lift the muscle away from the underlying structures and compress it between your hands or fingers. The main goals of Petrissage are to reduce muscle tightness, to improve tissue mobility, to increase local circulation, to decrease muscle spasm, and to improve muscle flexibility and to promote relaxation. Okay, Petrissage is especially useful for larger muscles such as upper trapezius, hamstrings, quads, quadriceps, gastrocnemius, and gluteal muscles. However, avoid using excessive pressure, especially if the patient has acute pain or sensitive tissues. Okay, now let's compare these two techniques. Effleurage and Petrissage. Effleurage is light, smooth gliding strokes, okay, and Petrissage is kneading and squeezing movements. Okay, Effleurage mainly used for warming up tissues, and Petrissage targets deeper muscle layer. Okay, Effleurage promotes relaxation and circulation, while Petrissage reduces muscle tension and improves tissue flexibility. Usually in clinical practice, we begin with Effleurage to prepare the tissues and then progress to Petrissage if deeper treatment is needed. Okay, so you should never jump directly into deep techniques. Always prepare the tissues first. A warm and relaxed muscle responds much better to treatment than a cold guarded muscle. Okay, also keep communicating with your patient throughout the treatment. Ask questions like, is the pressure comfortable? Do you feel pain or just pressure? Patient feedback helps you adjust your technique safely and effectively. Remember, manual therapy should be effective, but it should never be unnecessarily painful. Okay, now that we have covered the two basic soft tissue mobilization techniques, let's move to the next slide. We will learn some advanced techniques used for chronic muscle tightness, tendon problems, and facial restrictions. Okay, now let's move on to some advanced soft tissue mobilization techniques. So far we have discussed the basic techniques, that is Effleurage and Petrissage. These are excellent for preparing the tissues. However, in clinical practice, you will often see patients with chronic muscle tightness, tendon injuries, trigger points, or facial restrictions. In these cases, we may need more specific techniques. Let's discuss them one by one. First is deep longitudinal stroking. This technique involves applying firm, slow pressure along the length of the muscle fibers. The purpose is to reduce chronic muscle tightness, improve tissue mobility, increase blood circulation, restore normal muscle flexibility. For example, this technique can be used on the hamstrings, calf muscles, quadriceps, or upper trapezius. Remember, the pressure should be firm but always within the patient's comfort level. Second is cross fiber friction massage. Now let's look at cross fiber friction massage, also known as transverse friction massage. Unlike longitudinal stroking, this technique is performed across the direction of the muscle or tendon fibers, not along them. It is commonly used for tendinopathies, ligament injuries, scar tissue, chronic overuse injuries. The goal is to improve collagen alignment during healing, reduce adherence, stimulate tissue repair, and to improve tissue mobility. For example, it can be applied in conditions such as tennis elbow, Achilles tendinopathy, and patellar tendinopathy. Okay, these techniques can be slightly uncomfortable, but it should never cause severe or unbearable pain. Third is trigger point release. Now let's discuss about it. A trigger point is a tight, sensitive knot within a muscle that can cause both local pain and referred pain. Okay, the technique involves applying gentle sustained pressure directly over the trigger point for about 30 to 90 seconds depending on the patient's tolerance. The aim is to decrease muscle tension, reduce pain, improve blood flow, and to restore normal muscle function. Common muscles with trigger points include upper trapezius, levator scapulae, gluteus medius, piriformis, and gastrocnemius. Always monitor the patient's response throughout the treatment. Fourth is myofascial release. Finally, let's discuss myofascial release, one of the most widely used manual therapy techniques. The technique focuses on the fascia, which is the connective tissue surrounding muscles and other structures. When fascia becomes tight or restricted, it can limit movement and contribute to pain. During myofascial release, we apply slow, gentle, sustained pressure until the tissue begins to relax naturally. It is commonly used for facial tightness, chronic pain, reduced flexibility, postural dysfunction, scar tissue restrictions. Unlike some other techniques, myofascial release is not forceful. It requires patience, sensitivity, and good palpation skills. Now, one important thing you should remember is that every patient is different. There is no single technique that works for everyone. Okay, your treatment should always be based on your assessment findings, the patient diagnosis, tissue condition, pain level, and treatment goals. Sometimes one technique is enough, while in other cases you may combine multiple techniques within the same treatment session. Always reassess after each technique to determine whether the patient's pain, mobility, or tissue quality has improved or not. Okay, remember this principle. Choose the technique according to the tissue, not according to your preference. Okay, a skilled physiotherapist adapts the treatment to the patient's needs rather than applying the same technique to every patient. Okay, now that we have learned both the basic and advanced soft tissue mobilization techniques, let's move to the next slide where I will demonstrate how these techniques are applied in different regions of the body during clinical practice. Okay, now let's move to the practical part of today's workshop. So far, we have discussed the theory, anatomy, assessment, and different soft tissue mobilization techniques. Now it's time to see how these techniques are applied in clinical practice. You should know that manual therapy is a practical skill. Reading about the techniques is important, but becoming proficient requires regular practice, proper hand placement, and continuous feedback. Okay? So, let's begin with the upper trapezius, one of the most commonly affected muscles due to prolonged sitting, poor posture, stress, and computer work. Firstly, position the patient comfortably in sitting or lying. Begin with Effleurage to warm up the tissues, then use Petrissage to gently knead the muscles and reduce pain or tension. Okay, if you identify a trigger point during palpation, apply gentle sustained pressure for about 30 to 60 seconds depending on the patient's tolerance. Always ask the patient, is the pressure comfortable or not? Okay, now let's move to the levator scapulae. This muscle often becomes tight in patients with neck pain and forward head posture. Use slow longitudinal strokes along the muscle fibers, followed by gentle trigger point release if necessary. Avoid excessive pressure because this area can be sensitive. Next are the cervical paraspinal muscles. These muscles help support the neck and often become tight in patients with chronic neck pain. Use gentle gliding strokes and light pressure. Since this region contains important nerves and blood vessels, always work carefully and avoid applying direct pressure over the cervical spine. Now let's demonstrate STM around the shoulder. Treat muscles such as the supraspinatus, infraspinatus, teres minor, and deltoid. Use slow, controlled movements to improve tissue mobility and reduce muscle guarding. This is particularly useful for patients with shoulder impingement or rotator cuff dysfunction. For patients with tennis elbow, assess the wrist extensor muscles carefully. Next is forearm extensor muscles, okay? Apply cross fiber friction massage over the affected tendon when appropriate, followed by gentle stretching. Always explain the procedure beforehand because this technique may cause mild discomfort. Next is lumbar paraspinal muscles. Now let's move to the lower back. Position the patient comfortably in prone lying with a pillow under the abdomen if needed. Begin with gentle effleurage, then progress to Petrissage and longitudinal stocking. The goal is to reduce muscle guarding, improve circulation, and increase tissue flexibility. Remember, if you suspect a serious spinal pathology, manual therapy may not be appropriate until further assessment is completed. Next is hamstrings. The hamstrings are commonly tied in athletes and individuals with prolonged sitting habits. Use long gliding strokes followed by deeper longitudinal techniques as tolerated. After STM, reassess flexibility and consider adding hamstring stretching exercises. Next is gastrocnemius calf muscles. Finally, let's look at the calf muscles. STM is frequently used for calf tightness, sports injuries, and plantar fasciitis. Apply slow strokes from the Achilles tendon toward the knee while maintaining patient comfort. This can improve circulation, reduce muscle tightness, and prepare the muscle for stretching. Clinical demonstration tips: you should know that and remember these important points during every demonstration. Always explain the procedure before touching the patient. Secondly, obtain informed consent and position the patient comfortably, and use proper therapist body mechanics and maintain good hand contact throughout the treatment, and start with light pressure and increase gradually if needed. Okay. Next is continuously monitor the patient's response and reassess pain and range of motion after treatment. Okay. One important thing I want you to remember is manual therapy is not about how hard you press. It is about how accurately you assess and how appropriately you apply the technique. Okay. With regular practice, your palpation skills and hand control skills and then clinical reasoning will improve significantly. So don't rush to become fast. First become accurate. Okay. Speed and confidence will develop naturally with experience. Okay. Now we have completed our clinical demonstration. Let's move to the next slide and discuss the common clinical conditions where soft tissue mobilization can be effectively used in physiotherapy practice. Okay, now let's move to the clinical applications of soft tissue mobilization. So far we have learned what STM is, when to use it, when to avoid it, and the different techniques. Now the important question is, where can we apply these techniques in clinical practice? As physiotherapists, you should know that soft tissue mobilization is one of the most versatile manual therapy techniques. It can be used in a wide range of musculoskeletal conditions, but only after a proper assessment and clinical reasoning. Let's discuss some common clinical applications. First is neck pain. One of the most common conditions we see is neck pain. Patients often have tightness in the upper trapezius, levator scapulae, and cervical paraspinal muscles due to poor posture, prolonged computer use, or stress. Soft tissue mobilization helps reduce muscle tension to improve cervical range of motion, helps in decrease pain, and helps in prepare the patient for stretching and strengthening exercises. Okay. Second is shoulder dysfunction. Patients with shoulder pain, rotator cuff problems, or shoulder stiffness may develop tight muscles around the shoulder girdle. STM can be applied to upper trapezius, deltoid, pectoralis major, and rotator cuff muscles. The goal is to improve tissue mobility, reduce pain, and restore shoulder function. Third is low back pain. Now let's talk about it. Many patients develop tightness in the lumbar paraspinal muscles, quadratus, lumborum, gluteal muscles, and hamstrings. Soft tissue mobilization can help reduce muscle guarding, improve flexibility, and decrease pain. Okay. However, remember that manual therapy should always be combined with core strengthening, core correction, and functional rehabilitation for long-term improvement. Okay. Fourth is tennis elbow. Patients with lateral epicondylitis often have tightness and tenderness in the wrist extensor muscles. Okay. In these cases, techniques like cross fiber friction massage and soft tissue mobilization can help improve tissue healing and reduce pain when combined with progressive strengthening exercises. Okay. Fifth is plantar fasciitis. Another common condition is plantar fasciitis. STM can be applied to plantar fascia, calf muscles, and Achilles tendon. This helps reduce tissue tightness, improve flexibility, and relieve pain during walking. Sixth is IT band syndrome. Athletes, especially runners, often develop iliotibial band tightness. Soft tissue mobilization technique is performed around the lateral thigh, tensor fasciae lata, and surrounding muscles can improve mobility and reduce discomfort. Seventh is hamstring and calf tightness. Sports injuries frequently involve tight hamstrings and calf muscles. STM helps in improve flexibility, increase blood circulation, reduce post-exercise muscle soreness, and prepare muscles for stretching and strengthening. Okay. Eighth is post-operative scar management. After surgery, scar tissue may restrict movement. Once the wound has healed and with appropriate medical clearance, gentle soft tissue techniques can improve scar mobility, reduce adhesions, and enhance functional recovery. Now there is something very important that every physiotherapist should remember, that is, don't read the diagnosis, treat the patient. For example, two patients may both have shoulder pain, but one may have muscle tightness while the other have tendon irritation or joint stiffness. The treatment approach may be completely different. Always ask yourself what tissue is involved, what is causing the patient's symptoms, which STM technique is most appropriate, should I combine it with stretching, strengthening, or other rehabilitation exercises. That is what evidence-based physiotherapy is all about. Finally, remember this principle. Soft tissue mobilization is not the final treatment. It is a tool that prepares the patient for better movement, exercise, and functional recovery. Okay, now that we have discussed the common clinical applications of STM, let's move to the next slide, where we will look at the scientific evidence supporting soft tissue mobilization and understand why it is considered an evidence-based treatment in modern physiotherapy. Okay, now let's move to a very important topic, evidence-based practice. As healthcare professionals, you should know that every treatment we provide should be supported by scientific evidence, our clinical expertise, and the patient's preference. This is what we call evidence-based practice, or EBP. Today, physiotherapy is no longer based only on experience or tradition. We are expected to use treatments that have been shown to be effective through research. Now let's see what research tells us about soft tissue mobilization. Several clinical studies have shown that soft tissue mobilization can help to reduce pain in patients with musculoskeletal conditions, to improve joint range of motion, to increase muscle flexibility, to reduce muscle stiffness and tension, and to improve local blood circulation and enhance functional movement and overall quality of life. Okay. However, you should also know that STM is not a miracle treatment. Research consistently shows that the best outcomes are achieved when soft tissue mobilization is combined with other physiotherapy interventions. For example, therapeutic exercises, stretching programs, strengthening exercises, posture correction, home exercise programs, patient education, and activity modification. Okay, when these interventions are combined, patients usually experience better short-term pain relief and improved long-term recovery. Okay, now let's talk about patient education. As physiotherapists, our role is not just to treat patients during the session, we should also educate them about their condition, the importance of movement, proper posture, home exercises, lifestyle modifications. A well informed patient is more likely to follow the rehabilitation program and achieve better outcomes. Another important point is reassessment. Evidence based practice means we don't assume our treatment is working, we measure the results. After treatment, ask yourself, has the patient's pain decreased? Has the range of motion improved? Is muscle tightness reduced? Can the patient perform functional activities more easily? Okay, if the answer is yes, continue with your plan. If not, reassess the patient and modify your treatment accordingly. Now, here is one clinical message I want my students to remember. That is, don't become a therapist who treats every patient the same way. Okay, every patient is unique. The best clinicians are those who combine current scientific evidence, their clinical skills, and the patient's individual needs and goals. Okay, that is the true meaning of evidence-based physiotherapy. So remember this simple formula: best research evidence plus clinical expertise plus patient values is equal to evidence-based practice. Okay, if you follow this approach throughout your career, your treatments will become safer, more effective, and more professional. Okay, now we have understood the importance of evidence-based practice. Let's move to our next slide, where I will share some practical clinical tips and the common mistakes that every physiotherapist should avoid while performing soft tissue mobilization. Okay, now let's move to our second last slide, clinical tips and common mistakes. So far, we have learned the theory, assessment techniques, and clinical applications of soft tissue mobilization. Now, I would like to share some practical tips that can make a big difference in your clinical practice daily. Okay, these are simple points, but they help you become a safer and more effective physiotherapist. First clinical tip is start gently. Whenever you begin treatment, always start with light pressure. Don't apply deep pressure immediately. Give the tissues time to relax and allow the patient to become comfortable. As the muscles relax, you can gradually increase the pressure if needed. Second tip is monitor patient comfort. Always observe your patient's facial expressions and body language. Keep asking questions like, is the pressure comfortable? Do you feel pain or just pressure? Remember, communication is a part of the treatment. If the patient is uncomfortable, adjust your pressure or change your technique. And the third tip is reassess frequently. A good physiotherapist never treats without reassessment. After performing a technique, always check, has the pain decreased? Has the range of motion improved? Is the muscle less tight? Does the patient feel better? If there is no improvement, don't continue repeating the same technique. Reassess and modify your treatment plan. Fourth tip is combine STM with exercise. You should know that this STM gives the best results when combined with exercise therapy. After releasing tight muscles, prescribe stretching exercises, strengthening exercises, mobility exercises, functional training, and posture correction. Manual therapy prepares the tissues, while exercise helps maintain the improvements over time. Now let's discuss some common mistakes that many beginners make. First mistake is using excessive pressure. Many new therapists believe that more pressure means better treatment. This is not true. Excessive pressure may cause bruising, increase pain, muscle guarding, and reduce patient confidence. Always apply the minimum pressure needed to achieve the treatment goal. Okay. Second mistake is poor body mechanics. If your posture is incorrect, you may develop wrist pain, shoulder pain, or low back pain. over the time. Okay, use your body weight instead of your hands, instead only of your hands. Okay, keep your back straight and maintain a comfortable working position. Protect yourself while treating your patients. Okay, mistake 3 is ignoring contraindications. Never perform STM without checking for contraindications. Always review the patient's medical history, medications, and current condition before starting treatment. Patient safety should always be your highest priority. Fourth mistake is skipping the assessment. Never start treatment without assessing the patient. Assessment guides your clinical decision making and helps you choose the most appropriate technique. Remember, assessment first, treatment second. Fifth mistake is continuing despite severe pain. If the patient experiences severe or worsening pain during treatment, stop immediately. Reassess the patient and determine the cause. Treatment should challenge the tissues appropriately, but it should never cause unnecessary suffering. Final clinical advice. Before we move to the final slide, I want to leave with you one important message. Great manual therapists are not remembered because they use the strongest pressure. They are remembered because they use the right technique on the right patient at the right time. Okay, always be patient, gentle, and evidence-based in your approach. Continue practicing your palpation skills, improve your anatomy knowledge, and always keep learning. Okay, now we have reached the end of today's workshop. Let's move to our final slide where we will summarize the key learning points and then open the session for your questions. Okay everyone, we have now reached the final slide of today's workshop. First of all, I would like to thank each and every of you for joining this PMC Certified Workshop on Soft Tissue Mobilization Techniques. I truly appreciate your time, attention, and enthusiasm throughout today's session. Now before we end, let's quickly revise the most important points we learned today. Today we understood the soft tissue mobilization is an evidence-based manual therapy technique used to assess and treat muscle fascia, tendons, ligaments, and other soft tissues. Okay, we discussed the importance of having a strong knowledge of anatomy because successful treatment always begins with understanding the structures we are working on. We learned the indications and contraindications, and one of the biggest lessons from today's workshop is that patient safety should always come first. Never perform a technique without first assessing whether it is appropriate for that patient. Okay, we also covered the patient assessment process, including history making, observation, palpation, pain assessment, range of motion, and functional assessment. Remember, a proper assessment leads to better clinical decisions. Then we discussed the basic techniques such as Effleurage and Petrissage, followed by advanced techniques including deep longitudinal stroking, cross fiber friction massage, trigger point release, and myofascial release. Okay, after that we explored the clinical applications of STM in conditions like neck pain, shoulder dysfunction, low back pain, sports injuries, plantar fasciitis, tendinopathies, and post-operative scar management. Finally, we discussed the importance of evidence-based practice and the practical clinical tips that will help you become a safer and more confident physiotherapist. Now I want all of you to remember these 6 key messages. Assess before you treat. Second, understand anatomy before applying manual techniques. Third, choose the right technique for the right patient. Fourth, always respect contraindications and precautions. Fifth, combine soft tissue mobilization with exercise and rehabilitation. Sixth, never stop learning and practicing your clinical skills. Remember, becoming an excellent manual therapist doesn't happen in one day. It takes continuous practice, patience, good clinical reasoning, and experience. Every patient you treat will teach you something new. As healthcare professionals, our goal is not just to relieve pain. We aim to restore movement, improve function, and enhance our patients' quality of life. That is the true purpose of physiotherapy. Okay, now I would love to hear from you. If you have any questions regarding today's workshop, please feel free to ask. There are no small questions when it comes to learning, okay? For those watching the recorded session, please write your full name in the YouTube comment section so we can verify your participation. If you have any questions after the session, you can also post them in the comments and we will be happy to answer them. Once again, thank you so much for joining today's workshop. I hope you found it informative, practical, and beneficial for your clinical practice. Take care, keep learning, keep practicing, and I look forward to seeing you in our next PMC Certified Workshop. After commenting your full name and completing the recorded session, immediately DM me for certification form, okay? So thank you everyone and Assalamu alaikum.